Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, I'm Ivana Mutmainah Husen from 12 MIPA 7. In this video, I will explain about Marfan syndrome for biological mutation assignment. So before we start, have any of you ever heard of Marfan syndrome? Well, actually, this is a congenital disorder that affects connective tissue and affects several parts of the human body, such as the heart, blood vessels, bones, eyes, lungs, and skin. Then, you guys must be asking, what are the effects of this syndrome on the body? Is there any compilation that can happen? This syndrome generally affects 1 in every 5,000 people. One of the reasons for Marfan syndrome is that it is genetically inherited from one of the parents and is autosomal dominant. This means that if one parent has Marfan syndrome, the chance that their child will have this syndrome is 50%. However, 1 in 4 cases of Marfan syndromes occur not due to genetic factors. In this case, the fibrillin gene mutation usually occurs in the father's sperm or the mother's egg. The possibility is greater if both parents have Marfan syndrome. Marfan syndrome is caused by a mutation or abnormality in the FBN1 gene. Normally, this gene functions to produce the protein fibrillin whose job is to build elastic connective tissue in the body and control growth. Mutation in this gene limit the body's ability to produce fibrillin. As a result, the growth of elastic connective tissue decreases and bone growth becomes uncontrolled. In Indonesia, a new shocking was found, namely a girl from Pati who also have this syndrome. People with this syndrome can be recognized physically, usually their bodies look thin with disproportional arms and legs, growth pain, experience nerve tightness, tears keep coming out until the sternum protrudes. But these symptoms vary for each of the person. The severity of this syndrome varies ranging from mild to severe. The most serious damage can occur in the heart valves to the aorta. Some cases of Marfan syndromes are complications such as scoliosis, cardiovascular complications, and several other complications. Until now, there is no treatment that can be done to treat this syndrome. But some treatments can be done to reduce the symptoms that arise and minimize complications. People with Marfan syndrome are advised to carry out routine health checks such as the eye, heart, the bones, then to deal with complications that may occur. Usually, the doctor will also perform surgery on the problematic part of the body. Marfan syndrome cannot be prevented. However, the risk of complication can be reduced by detecting and treating Marfan syndrome early, as well as carrying out further consultation and genetic examinations before planning a pregnancy. Well everyone, I think it's enough to explain about Marfan syndrome in this video. I'm so sorry if there's any mistakes and maybe some grammatical error, and I would like to say thank you for watching this video. See you in the next video, and wassalamualaikum warahmatullahi wabarakatuh.